So next we're going to talk about the carbonic anhydrase inhibitor or inhibitors, but mainly is we're going to talk about one inhibitor only, carbonic anhydrase inhibitor, which is acetazolamide. So this drug and the other carbonic anhydrase inhibitors are more often used for their other pharmacologic actions, meaning that for other than their diuretic effects, okay, because they are much less effective. So they are much less effective compared to the thiazides or the loop diuretics. Okay, so it's really not on the top of the list, okay, in terms of its diuretic effects. So acetazolamide is mainly used for other purposes. So this is not a really important drug for this topic, okay, of diuretics. So basically the mechanism of action is that it inhibits carbonic anhydrase, which is located intracellularly, which is in the cytoplasm, and also on the apical membrane of the proximal tubular epithelium. Okay. So on the apical, okay, so we have the apical membrane and also intracellularly. Okay. So apical membrane and also intracellularly. Okay, inside the cell in the cytoplasm. So we have carbonic anhydrase. So this is the lumen, and this is blood, and this is the epithelial cell of the renal tubule. So when we have acetazolamide, that will cause a reduced ability to exchange sodium for hydrogen. Okay, sodium for hydrogen. So sodium is supposed to go in, hydrogen is supposed to go out. Okay. So when you have acetazolamide, that will inhibit this. So you will have less production of carbonic acid, and so carbonic acid usually will spontaneously dissolve, or dissociate and become ionized into hydrogen and bicarbonate. Okay, so when you don't have this, so you don't have hydrogen, so there is not much hydrogen to be exchanged for sodium. Okay, so and that will cause mild diuresis. Okay, mild diuresis because of less sodium to be reabsorbed in exchange for hydrogen. Okay, in addition to that, bicarbonate is retained in the lumen with marked elevation in urinary pH. Okay, so bicarbonate is going to be retained because it doesn't really doesn't combine with hydrogen, so we cannot form carbonic acid and cannot form water and carbon dioxide because of the lack of carbonic anhydrase. Okay, because of the action of carbonic anhydrase being inhibited. So we have more carbonic acid. We have more bicarbonate, and that will increase the urinary pH, becomes more alkalinized. And the loss of bicarbonate, since that the bicarbonate is being retained, in the lumen. So when we retain this, so it is going to go out, in the urine. So more bicarbonate goes out. So when more bicarbonate goes out, so as it might not surprise anyone, it's going to cause more in the blood to become more acidic. Okay. So we're going to have a hyperchloremic metabolic acidosis and a decrease in the diuretic efficacy following several days of therapy. Okay. So meaning after a few days of therapy, the diuretic effectiveness is going to reduce, and also we might get a hyperchloremic metabolic acidosis. Okay, hyperchloremic metabolic acidosis. Okay, so it's we remove all this bicarbonate, remove all the alkaline, so it becomes more acidic in the blood. Okay, and phosphate excretion is increased. Okay, somehow the carbonic anhydrase inhibitors they tend to increase the excretion of phosphate, but the mechanism is not that clear. Okay, what are the therapeutic uses? Okay, so since that this is not so much of diuretic related effects, it's not renal related effects, so we're just going to go through this very fast, very quickly. So number one is glaucoma, which is the increase in the intraocular pressure. So when you have for example, if there is a blocked canal, okay, and so there is too much fluid, which increases the pressure here, and that can damage the optic nerve. Okay, when damage the optic nerve, it can cause blindness. So that glaucoma. So because acetazolamide reduces the production of aqueous humor and reduce intraocular pressure in patients with chronic open-angle glaucoma. So that's why we tend to give acetazolamide in patients with chronic open-angle glaucoma. Okay, and one good thing about the topical, because we have the topical topical carbonic anhydrase inhibitors, so they have the benefit of not causing systemic effects. So you will not see systemic side effects. So topical carbonic anhydrase inhibitors like Diuretics, brinzolamide. Okay, so these are all beneficial because it's topical, and it can give directly, so it doesn't cause any unwanted systemic effects. Number two, it's used in mountain sickness. So it can be used for prophylaxis, for prevention of acute mountain sickness. So it will prevent weakness, breathlessness, dizziness, nausea, okay, and also cerebral and pulmonary edema, so which are all typical of mountain sickness. So the pharmacokinetics, it's taken per os orally or intravenously. Okay, so about 90% are protein bound, and this drug is eliminated renally, okay, from the kidney. Adverse effects, as mentioned previously, metabolic acidosis, okay, metabolic acidosis, which is usually mild. Potassium depletion, okay, so removes potassium. Renal stone formation, okay, renal stone formation, drowsiness, and also paresthesia. So acetazolamide should be avoided in patients with hepatic cirrhosis, as it could lead to a decreased excretion of ammonium. Okay, because hepatic cirrhosis can cause decreased excretion of ammonium. So the next group of drugs are osmotic diuretics. We will continue in next time.